Hello, my name is Kenneth Euzu, and in this lecture, I will talk about ensuring a choice of quality contraceptives to reach those who need them. Across the developing world, the decision of whether, when, and how often to have children continue to create challenges for government, societies, communities, families, and individuals. Global efforts to support national actions focus on ensuring that every individual is free to make an informed decision to exercise this fundamental choice, whether, when, and how often to have children. Today, in lower income countries, there are around 225 million women and girls who do not want to get pregnant now or in the next 2 years, but they are not using modern contraception. This unmet need is being addressed by increasing the availability of full range of quality contraceptives, but for many women and girls, much more is needed. Not wanting to get pregnant does not mean that someone necessarily wants, is willing to, or able to use modern contraception. There continue to be many barriers from misconceptions and myths among individuals, families, communities, societies, and governments, like I have heard the pills will make me infertile, to enduring behavioral and societal norms surrounding proof of fertility and parenthood. This all required attention if individuals are to make free and informed choices about contraception. To ensure individuals can decide whether, when, and how often to have children, we need global efforts implemented with government leadership in country. I will briefly discuss the main 5 components of these efforts. The first component to consider is creating an enabling environment. This goal here is to improve availability of contraception and access to related services. It is also important to reduce barriers to services, for example, legal and regulatory barriers. A crucial early step is to ensure that provision for quality family planning services are taken into due account in national policies, plans, and programs, highlighting evidences of health and economic benefits of making contraceptives available to government, policymakers, and other partners helps ensure national ownership and the sustainability of commitment. The second component is to increase demand for family planning according to users' reproductive health intentions. When people become aware of how family planning can help them meet their needs, demand for these services grows. Efforts focusing on informing, educating, and communicating with users and potential users about contraceptives and services, and these efforts need to be culture, gender sensitive, involving community members in planning, implementing, and evaluating family planning programs for their community can lead to more relevant, cost-effective, and equitable interventions. A total market approach can also drive expansion of family planning services and demand for contraceptives. Here, all sectors work together to deliver health choices for all segments of the population. The goal is to ensure that those in need are reached with appropriate and affordable products. The third component is improving the availability of quality contraceptives. Process for procuring contraceptives needs to be efficient and environmentally friendly, and they need to deliver an appropriate mix of contraceptives based on users' needs. This requires the in-country forecasting of those needs, followed by the procurement and supply chain management of the commodities. Also important are market-shaping efforts that reduce prices, improve supply security, foster innovation, and promote quality assurance. The fourth component is improving the availability of good quality human right-based family planning services. Dismantling barriers and facilitating access to family planning services requires action on many fronts. Efforts include strengthening youth-friendly services, enhancing community-based services, and providing family planning services in humanitarian settings. Also key is capacity building of service providers to ensure that counseling is objective and unbiased, and that the client selects and receives the contraceptive method of their choice. Additional efforts focus on integrating family planning services with related services. For example, in the fight against HIV/AIDS, as well as other sexually transmitted infections. While better meeting client needs, integration can increase the efficiency and effectiveness of health system and of healthcare providers. The final component focuses on enhancing national capacity to monitor progress of these interlinking efforts. This encompasses the inclusion of family planning indicators in routine data collection efforts and the use of improvement of a functioning logistic management information system to ensure the supplies reach the people who need them. Data gathering efforts from related sectors can also make an important contribution. For example, education sector efforts to track secondary school attendance, particularly of adolescent girls. To sum up, in combination, enabling environment, creating demand, ensuring supplies, increasing quality of services and data are supporting the efforts of national government to make good on their global commitment to ensure universal access to family planning. Experience shows that this global effort is more effective and yields better and more sustainable results when there is steady and flexible multi-year support. Universal access to family planning is possible when significant investment in capacity development are combined with information and communication efforts and the large-scale provision of contraceptives. These investments save lives, empower women and girls, strengthen health systems, and have a profound and lasting impact on the well-being and health of whole populations.